While we all know that we can catch feelings from our canine companions, did you know that we can also catch diseases from them? Today we are covering 5 illnesses that you can actually contract from your pup. Welcome back to Alpha Paw, your destination for everything dog. I'm on a mission to answer every doggone question you have ever had about your fur babies. And today we are talking about 5 diseases you can actually get from your pup. Fortunately, we have with us today an expert vet, Dr. Jordan Cole. Dr. Cole earned his veterinary degree at UC Davis School of Veterinary Medicine in 2018 and has considerable training in both small and zoological animal medicine. Beyond clinical work, his interests include endangered species conservation and One Health, and he is currently involved in giraffe research. Dr. Cole will be filling in for Dr. Ross today, and we are so happy to have him. Welcome to Alpha Pod, Dr. Cole.
Thanks for having me back, Bernie. And as always, it's an honor to fill in for the legendary Dr. Ross.
Well, thank you for being here. I know just right off the bat, this is a scary topic to just see. I mean, these are our precious angel baby animals that we have in our homes. And at the end of the day, we do have to remember that they are animals, and animals, just like humans, can get diseases. So today we're going to be discussing zoonotic diseases, which I could probably explain in a far worse way than you can. So Dr. Cole, can you explain to us what those zoonotic diseases are?
Sure. I'm sure you do a great job, Bernie. But zoonotic diseases, or zoonoses, are infectious diseases that can be transmitted between humans and other animal species. These diseases can be bacterial, viral, fungal, or parasitic organisms. And the CDC actually estimates that 6 out of every 10 infectious diseases of humans are zoonotic diseases. They can be transmitted in a number of ways, either by contact with animals, either directly by touching them or potentially being bitten, or indirectly through contacting bodily fluids such as feces or urine. Also, they can be transmitted via arthropod vectors, so mosquitoes or ticks are an example. Or zoonotic diseases can be foodborne illnesses as well. And overall, I just want to say that pets pose a relatively minimal threat to us as owners, as far as us getting sick from them is concerned. However, individuals that might be immunocompromised might be at a little bit of a higher risk of contracting a zoonotic disease.
Well, I appreciate you explaining all of that. Now, I do want to get into the first disease. Like you said, our dogs, our pets pose a minimal threat for us contracting these zoonotic diseases, but it is important to be aware of them. So let's get into the first one.
Certainly. So first, I'll talk about a disease that is actually fairly rare among humans in developed nations, but is still really important to talk about from a public health perspective, and that is rabies. In the US, it's estimated that there are actually less than 5 human cases of rabies per year, and that's due to proper vaccination practices. But rabies is a virus that potentially any mammal can get sick from. It's shed in the saliva, so most of the time it's transmitted via bites, and it can cause a whole range of neurologic signs in a host. Anything from acting abnormally to extreme aggression to, on the other side of the spectrum, paralysis, and everything in between. This virus is actually pretty slow to develop in the host. It can take weeks or months or even longer, but certainly will be fatal if it's not treated promptly. And that's why rabies is a mandatory vaccine for dogs in the United States, again, to make sure that they don't get this disease and spread it.
So fun fact about rabies, I actually got bit by a raccoon when I was in 5th grade. And thankfully, it was not a wild raccoon. We were at some zoo exhibit and I was leaning on the cage. Of course, they said don't lean on the cage, so that's what I did. And a raccoon bit me, and it was a whole thing, and they had to call my parents, and I had to get a shot. And long story short, all of those symptoms of rabies, I low-key think I just carried with me into my adult life. And that is why I am the way that I am. Moving on. The next disease I want to talk about, Dr. Cole, is ringworm. I feel like that's a fairly common one that people hear about, but truthfully, I don't think a lot of people know how they can get it, how it looks in their dogs. So let's just kind of go over ringworm.
Ringworm is actually a bit of a misnomer. It's actually not a worm at all, but a group of fungi that colonize superficial layers of skin, hair follicles, and sometimes the nail beds. Actually, the medical term for ringworm is dermatophytosis. And as you can imagine, ringworm is transmitted mostly via direct touching of infected areas of skin or hair. In dogs, ringworm can cause areas of patchy or circular hair loss, or oftentimes it won't even cause any clinical signs. That's called being subclinical. A subclinical disease means that an animal is infected and may even be shedding a pathogen, but is not demonstrating any clinical signs of illness. And that actually is the most common form a lot of times in ringworm, is to carry the disease, but not to demonstrate any clinical signs.
I see. Okay. So if your dog has ringworm, like you're saying, I guess it's like a skin to skin contact transmission, right? So what does it look like in humans if we get ringworm?
Yeah, it's a great question. So humans can show red circular rashes. That's where the term ringworm comes from. They can look like rings. But again, a lot of times in people, it can be subclinical as well, where a person may have the infection on them, but might not show any signs outwardly. And actually, both in dogs and people, the most common reason why someone would show infection with ringworm is if they are immunocompromised, or if they are infected with something else or have some other illness that's weakening their immune system and causing the fungus to grow more and cause problems. Important to note that ringworm is fairly innocuous, both in dogs and humans and in most animals. It is treatable with prolonged antifungal therapy and able to be cured in dogs and in humans.
That is good to know. So it's just gross and it's not necessarily life-threatening. So that's great. So another really common illness that I want to discuss with you, Dr. Cole, is Giardia. Now, I know a lot of people have heard this term, but again, we don't necessarily know what it is or what it looks like. So can you kind of explain that to us a little bit?
Definitely. So Giardia is a microscopic single-celled parasite that colonizes the GI tract, mostly the small intestine. It's spread usually via fecal-oral transmission, and dogs actually most commonly get infected from drinking contaminated water outside. Giardia can cause pretty significant diarrhea. Occasionally can cause other GI signs like vomiting, or again can be shed subclinically. So a dog might not show outward signs of Giardia, but still be infected. Diagnosis is pretty straightforward. It's with fecal analysis. So easy enough, just drop off a stool sample at your veterinarian. And treatment is usually just with oral medication. Giardia is transmissible to humans. I actually contracted Giardia as a fourth-year veterinary student. It was not enjoyable, I can tell you. But I promise you, I wasn't sitting there eating, my patient's poop or anything like that. It's very.
Like anyone was wondering that, but I'm really happy to clear that up just in case.
Well, I say that because, it just goes to show that it's so easy for, microscopic organisms to contaminate our environment. Like you were saying earlier, dogs, come into our homes, we use the same furniture, they sleep on our bed, yada, yada, yada. So it can be very easy to get infected, indirectly. There are many other parasitic organisms that can be spread via fecal-oral transmission, not just Giardia. So again, highlighting the importance of, sanitation, hand washing, prompt disposal of feces, and so on.
Excellent. Well, I'm sorry to hear that you had Giardia. And speaking of diarrhea, there's a sentence I didn't think I would say. Let's talk about salmonella.
Sometimes I feel like I spend my entire day talking about diarrhea, so I'm used to it. Salmonella is a bacteria. It also causes diarrhea in dogs. It can also, though, be subclinically shed as well, where a dog can have it, not have diarrhea, but still spread it in the environment. Similar to Giardia, it's spread via fecal-oral transmission, and environmental contamination can lead to human infection. Commonly, Salmonella is known as a foodborne illness as well, similar to other bacteria such as E. coli you may have heard of.
Mm-hmm.
So it is associated with contaminated food sources such as undercooked meat or poultry products, or even unwashed produce. So this is actually a big reason why a lot of veterinarians recommend against feeding your dog raw food diets. And that's because they can be hazardous not just to your pet, but to yourself and to the other people in your home as well.
It's interesting you talk about the raw diet situation. We actually had a previous video discussing sort of the downfalls of that diet. So I'm really glad to hear that Salmonella is just reason 400 not to put your dog on a raw diet. Now, Dr. Cole, these are some of the more familiar diseases that we can get from our dogs. Are there any we should be aware of that maybe aren't so common?
Sure. One quick one is a bacteria called leptospirosis. That bacteria is just found outdoors in the environment and can cause really significant kidney and liver disease in dogs that unfortunately requires really intensive hospitalization and can be fatal. Interestingly, about leptospirosis, it is shed in urine, and can cause a range of clinical signs in people as well. And there is a vaccine for leptospirosis. So that's one that you could ask your veterinarian about as well.
Amazing. So if I'm hearing correctly, I think if we just keep our dogs up to date on vaccinations, keep ourselves and our dogs clean, wash your hands, bathe them, and don't let them eat random things, I think we are pretty good to go. Am I right?
Exactly. You're sensing a theme here. Hygiene is always a good idea, not just for us, but for our pets. Routine parasite prevention, monitoring yourself and your animal. If you have any concerns about illness, don't be afraid to contact your doctor for yourself or your veterinarian for your pet. And I'll just say that, zoonoses should not, scare you from owning or loving on your animal. But it is important to be knowledgeable about them and do what we can to mitigate risk.
Absolutely. Well, thank you so, so much for being here, Dr. Cole. I learned so much. I hope our viewers did too. Do you guys have more questions for Dr. Cole? Drop them down in the comment section below. Again, I'm Bernie Zilio, and this is Alpha Paw. Be sure you subscribe so you don't miss a single doggone episode. We'll see you next time.